So the fourth challenge that the mother can have during breastfeeding is the baby having some white patches in the mouth and the gums. This is called as oral thrush. This can also be in the mother's nipples, so from which the baby could have got these white patches. This is actually a fungal infection which can cause great discomfort for the mother and baby. So if the mother notices such white patches in the gum and in the oral cavity, they will have to contact their doctor immediately to get medications to treat this condition. So something that can prevent this oral thrush, the main source of this oral thrush usually is when it's to the mother's nipple. So if the mother had some thrush in the nipple, the baby can get infected. So the ideal way of preventing this is in between feeds, the mother has to keep her breast and nipple dry to avoid such problems occurring. The fifth challenge that a mother can face is a blocked milk duct. So we said engorgement of breast. Here in blocked milk duct, what happens is there is one side of the duct, the side of the breast that feels lumpy, and that is because of the obstruction of one half of the duct in the breast to which the milk is not secreting out. So how do we treat this? Like an engorgement of breast, we can apply hot packs over the breast and massage the area which is lumpy towards the nipple. Apart from that, you can also hold the baby in a position where the baby is attaching more towards the area where there is a lumpy breast, so that the baby tries to take more of milk on that side. The next challenge that a mother can have is mastitis, which is a breast infection. This also can occur because of engorgement of breast. When there's lots of milk in the mother's breast and it is not expressed out, there can be a secondary infection in the breast. So this might present with again a full breast with redness in the area. The mother can have chills and fever, which can occur during mastitis. So can a mother not feed when she has mastitis? No, she can continue breastfeeding. She should ideally express more of her milk outside, and the baby should continue breastfeeding. She should take, the mother can take pain relievers like paracetamol or ibuprofen if she's having severe pain due to the mastitis. Regularly continue the hot packs and massaging of the breast, expressing of milk, and frequent breastfeeding. The next problem that a mother can have after mastitis is abscess. So we said about mastitis, which can be infection. Abscess is where there's a collection of pus in one side of the breast. So for this, the mother will have to see her doctor, get appropriate medicines for treatment. Sometimes if needed, a procedure might be needed to relieve the abscess, but the mother can still continue breastfeeding. The mother can still continue breastfeeding. Another thing very rarely seen is tongue tie, where the baby might not feed very well. So what is tongue tie? It's a strip of skin that attaches the front of the baby's tongue to the inner part to the floor of the mouth. So sometimes some babies who have tongue tie can have difficulty in feeding. So how do you know that your baby is not having adequate feeding due to tongue tie? When the doctor notices the tongue tie and the baby has had significant weight loss, with inadequate passing of urine, it also all shows that the baby has not been able to have sufficient milk. So if there is significant issues because of a tongue tie affecting feeding, it needs a very simple procedure where they remove the tie which attaches the tongue to the base of the tongue, and subsequently the baby starts taking breastfeeds well. So the last challenge that a mother can have during breastfeeding is a flat or inverted nipple. So if they see their doctor on examination, they can find out whether they have really a flat or inverted nipple. So this is when the nipple is not protruding out and it's towards the base of the breast, or the nipple is inverted. So can a mother breastfeed her baby if she has a flat nipple? She can definitely. There might be some challenges, but she can overcome the challenges and definitely breastfeed her baby. So some things that we try to do for a flat inverted nipple for a mother is to use a syringe to pull the nipple out and tell the mother to latch the baby immediately to take the milk. Over time, the baby starts learning to feed from the breast which has the flat or inverted nipple. Another thing that she can do is to use a nipple shield. The nipple shield acts like a nipple, an extended part of the nipple of the breast, breast, and it helps the baby latch on to the breast to get adequate milk. It might be a challenge in the first few weeks of life, but as the mother keeps doing this regularly with the baby learns to breastfeed from the mother. Hope this was very useful. If you have any doubts regarding any challenges during breastfeeding, you can contact us in the link below. Thank you.